Today we're embarking on a journey to explore two seemingly disparate health conditions. We will delve into their individual characteristics and then uncover the surprising connections that bind them together. AIDS and obsessive-compulsive disorder, or OCD, and the surprising ways they can intersect, revealing the intricate relationship between our physical and mental well-being. AIDS is a serious illness caused by HIV, a virus that specifically targets and weakens the immune system, leaving the body vulnerable to opportunistic infections, which attacks the immune system, compromising its ability to defend against diseases and infections. This can have devastating consequences for overall health. OCD is a mental health disorder, characterized by persistent intrusive thoughts and the overwhelming urge to perform repetitive behaviors. That traps people in cycles of unwanted thoughts and repetitive behaviors, significantly impacting their daily lives and overall quality of life. At first glance, these conditions seem unrelated. One a physical ailment, the other a mental health challenge. One targets the body, the other the mind, residing in what we often perceive as separate realms of health. But medicine often reveals unexpected connections, highlighting the interconnectedness of various bodily systems and psychological states between physical and mental health, demonstrating that what affects the body can also impact the mind, and vice versa. The fear and anxiety surrounding HIV and AIDS, particularly the fear of contracting the virus, can become a central obsession for someone with OCD, fueling compulsive behaviors aimed at reducing the perceived risk. This creates a unique challenge, a complex interplay between a physical health threat and a pre-existing mental health condition. A mental health struggle intensely focused on a life-altering virus where the fear of infection dominates thoughts and actions. Understanding this intersection is crucial for compassionate care, allowing healthcare professionals to address both the physical and psychological needs of the individual. We'll look at what causes these conditions, exploring the biological and environmental factors that contribute to their development, how they're diagnosed, examining the methods used to identify and differentiate between AIDS and OCD, and where their symptoms overlap, particularly the anxiety and distress that can accompany both conditions.